let's look at the practical work for the sinuses. We're going to start this with a nice eyebrow sweep. We're always working inwards, outwards with the sinuses because we're trying to encourage that natural drainage which is going to occur around here. Remember the ear, nose and throat are all very connected, so it's not unusual during this treatment to have your client swallowing as the sinuses clear. So adding just a little bit of moisturiser just so that I'm not dragging the skin, literally just putting it on here. And then we're going to sweep across the eyebrows, little bit by little bit. You'll have seen this elsewhere in some of the other videos, but it's really effective for sinuses. You can see here, rather than doing it as a point, which we've done in some of the other work, I'm doing it a bit more flat of thumb, so the area that I'm covering is broader. Now, for somebody with a flare-up of sinuses, this might be quite tender to touch and the forehead might be quite puffy. So just be gentle with your pressure, but you're trying to encourage that movement, and you can repeat this 3 or 4 times. Now this is where your client might kind of start swallowing just as the sinuses start to drain. After we've covered the eyebrows, we're then just going to come up the forehead. We're repeating everything 3 or 4 times. You can see I'm not just kind of going at the depth where we're applying a lotion, but neither am I trying to get really deep into a muscle. It's all quite surface here and quite delicate. So I'm just coming up little bit by little bit. If you feel that the skin's starting to drag a little, like it is there, just apply a little more lotion. You won't need much, but it will just keep everything moisturised. It will how much you need will depend partly on the client's skincare routine, where they work, where they live. If you live in a very cold or a very hot environment, you're likely to need more moisturiser than if you're in a kind of an environment like this where you get a bit of both, often in the same day. And you can just keep repeating that. It's quite a gentle massage to do, but it's one that will be appreciated by your client. So we caught the eyebrows there, we're coming up. See, I'm covering a little bit more each time as I'm flattening my thumb. So I'm using the whole of my thumb now to do this treatment. Then we're going to move to the sphenoid and ethmoid sinuses, and these are the sinuses situated on the inside of the eye socket towards the nose. The easiest way to find them is it should be kind of at the edge of the eyebrows, but depending on the eyebrows, but you'll feel the end of the eye socket where the eye socket meets the bridge of the nose, and you're rolling in just slightly from there, ever so slightly. You can see that movement. See, kind of about here. And I'm just pressing and releasing. I'm using my little fingers because I don't want to put too much pressure on. It's a very delicate area, so you don't want to cause any inflammation by what you're doing. So I'm pressing and I'm holding. I'm then moving down so that I'm equal with the inside of the eye. Either side of the bridge in the nose. Again, being very careful. And you can see why we've discussed about not having long nails while you do this. This work would be quite dangerous to do if you've got long or artificial nails, because you could be digging into the client's eye. We're going to repeat all of that 2 or 3 times. So if you do always work with false nails on, this might not be a treatment for you to do. But I suspect most of us who work in massage only get decent nails when we go on holiday and take time off. So you can repeat that, as you can see, 2 or 3 times. Then the maxillary sinuses are the largest of the sinuses, and they're in the cheekbones. When inflammation's present, they're likely to be quite tender to touch. We're working out across the cheeks from nose to ear, and again we're going to use a little bit of moisture cream just so that we're not dragging the skin. And although you can see the cream on the skin now, that will just absorb in as we work. Make sure we keep it away from the eyes. I tend to use either the hook, kind of a hooked little finger, or you can use your this finger, and you can pull outwards there. You can see I'm following the line of the cheekbone, and I'm coming out towards the ear. I'll show you again with my little finger. And you can see here why you need that moisturiser. Make sure if you're using your little finger that you keep the other fingers out the way so you don't accidentally poke your client in the eye. So I'm starting with sweeping motions, but I can also use that press and release. All the way out to the edge of the ears. And if your client's very congested, you can also kind of roll each finger. So you're kind of squeezing it along. You will find a movement that feels quite natural to you. Some of these may not feel very natural at first. Some you'll get used to. Some you'll just adapt to your own movement. But always working outwards towards the ears. And then you can use those small circular movements that we used across the forehead. And that will show you again on the forehead, out towards the ears. So the circular movements, again, you're starting from the middle. You're working outwards. It's quite gentle, but you can see I'm moving the skin. And you can finish by smoothing it off again. It's a bit of a treat of a treatment this as well, because your client's getting a nice moisturiser treatment as you're working. And you can repeat all of that as many times as you need.